Chanel, I just want to start with you because you've got innovation in telemedicine, but I know one of the things that we're always trying to encourage is group work, group visits, the way that groups of people are working together. Can you just share a little bit about how you've managed to sort of meld the world of telemedicine and groups?
Sure, you bet. I actually started doing groups because it's a great way to get the help to where the patients are. So you can see the patients in their houses, in their offices, and it's a great way to reach populations of people who are otherwise hard to reach, like busy professional moms, because then they can make time for self-care if you can bring it to them via telemedicine. So my own group program actually started back when I wrote a book a few years ago about the 7 foundations of health and happiness, and it was the core message is basically letting go of perfect and trying to balance a little bit in all the important areas of your life instead of trying to just completely nail one and leave the other sort of neglected. And what I found is that in working with people one-on-one, they actually needed more support to apply it to their lives. And because I had already done some work with groups in my training with the Center for Mind-Body Medicine and some other models, it just seemed like a natural fit. So I put together an 8-week program that goes through all 7 foundations and a week for behavior change. And then we tested that out in a public mental health clinic in rural Colorado. And we actually just published the results of that in the Journal for Technology and Behavioral Health. And what we basically found, there was a lot of results, but the most interesting ones to me were the qualitative results. And that's that the patients felt that it was a practical way to learn stress management skills. They felt that it contributed to their relationships and their quality of life. And the interesting part was that they all, there were actually no dropouts from any of our 2 groups, which if you've ever done any group work, that's really unusual. They all found it very satisfactory. And when we asked them specifically whether they felt that the telemedicine group experience felt real to them, we got unanimous yeses. So I was really excited to hear how much they enjoyed the group. And I love the idea of telemedicine group therapy because you can bring it to wherever the patient is, no matter how far out in the middle of the boonies they live, you can bring telemedicine to them. And the group actually cuts down the cost. So more people are being seen at once, so you've got the cost barrier reduced. But then, ironically, they're actually getting more connection time because they're having more face-to-face time with the doctor. So it's kind of a win-win on both sides. Plus, you have the power of the group. I really do believe that groups can heal and can help us do things that we can't do on our own, and you get to harness all of that. So I see it as the way that we can bring functional and integrative medicine to the masses in a way that's going to work.
I think you've just had a moment there. That is the future of psychiatry and really the future of functional medicine, using technology, using groups. Thank you so much for sharing. I think that's really powerful. Michael, I'd just like to ask you, Michael runs the Boulder Functional Forum Meetup Group and is a doctor of acupuncture for decades. You heard earlier Scott Shannon talking about his group, his team that he had. What do you feel like the Chinese medicine provider adds to a sort of an integrative team that wouldn't be delivered from like a team of pharmacists, psychiatrists, and naturopaths?
Yeah, I think the beauty of acupuncture is many levels to it, but it's one of the modalities like bodywork therapy, which is where I started, that gets in under the radar of the mind, where you're connecting with a person where they're not mind to mind, which has value, addressing belief systems, traumas, attachment styles, all the wonderful things we learned about. But you're getting a connection to a deeper level of the person's being, and where it's not primarily a mental experience. And if you've ever had a massage and kind of dropped into that place, or had an acupuncture treatment and dropped into that place, there's something profound that can happen there. And Chinese medicine inherently is a mind, body, spirit, heart medicine. And so ideally, we can treat a patient from the most superficial levels of their symptoms to the deepest level of their being, so that more of them becomes embodied and expressed, more of the largeness of who they are becomes expressed in their lives. So I consider a Chinese medicine modality, acupuncture is very beautiful if the practitioner has that orientation of seeking to touch a person at the deeper levels of their being. So I really consider it an essential part of a person's journey of healing.
That's awesome. Yeah, I totally agree. And real value in thinking through the cases from just that other perspective too, right?
Well, yeah, because in Chinese medicine, when we talk about the organ systems, we're talking not just about the physical liver, but we're talking about judgment, the ability to follow through on something, anger, which can be healthy assertiveness or rageaholic, And, there's different levels. When we speak about the organs, we're speaking about those different levels of being. And having run a integrative, collaborative, multidisciplinary clinic for 19 years in New York before moving to Colorado, I know the power of that collaborative team model. That's how I was trained, and that's what I created in New York. And it's profound. And when you hear the physician and the acupuncturist and the holistic nurse and the massage therapist and all talking about the same patients, or at least perspectives on patients, it's a dramatic experience. We just loved our weekly staff meetings because that connection time, that community of practitioners was a healing experience for us too.
Absolutely. This is getting a lot of love on Twitter. Amy Sapolo's a PharmD as well. Loved hearing Izabella and having a pharmacist on the Functional Forum. I think maybe the first time we have, although you were on a panel here last year. And she says, telemedicine in group, what a fantastic idea. Provides the power of the group as a practical way to reduce the cost barrier of functional medicine. That's really exciting. Will and Janet, I'd love to just ask you, you heard Isabella's talk here on the thyroid. I'd just love to get your sort of experience of being on the front line of mental health and how that landed with you.
Well, the front line of mental health is a rugged place to be. But I've really been blessed to have great community, and that's really what's saved me. And, I've learned over the years to take time to be with my colleagues, my friends, to share ideas, to understand root causes, to be able to treat the actual root causes instead of just medicating symptoms. Learning about autoimmunity and the gut and psychiatry and all of these connections, inflammation and trauma. It really just brings everything together. So it's much more fulfilling to practice this way. And it's especially enjoyable to do it in community.
Just the most fascinating thing that Janet and you talked about in my mind was this bi-directional way of the way things go in different directions. How confusing is that going to be to doctors who are very much trained in sort of a linear way of thinking that this causes that and there's no other real side effects? I mean, I'd love to get your thoughts on how we can communicate ideas that are quite foreign to a wider physician audience.
I have a lot of faith in the ability of physicians to absorb this information. I think it's just not out there, that trauma is a pattern that exists in the nervous system that changes the entire body. And physicians have adapted to the idea of leaky gut and autoimmunity and environmental toxins and all kinds of things, and I think we can adapt to this too. We just have to put this on the map. We need emotional trauma to have a seat at the table so that this person is a member of the team, and I agree with what you said about acupuncture. In my experience with acupuncture, I think that the beauty of Chinese medicine is that it treats people simultaneously. With a single elegant needle, you can treat someone on a spiritual, emotional, physical, and mental level all at the same time. And so it's an Eastern medicine concept that we can incorporate into functional medicine, where we think of all these things happening simultaneously on different levels. Something's happening spiritually and emotionally for the patient. It's also happening in their body. It's not like two things happening, it's one thing happening. And so I think your point is a good one, but I've been impressed by the prairie fire of functional medicine excitement spreading across the country, and I think we can incorporate this into that.
Absolutely. Izabella, last word to you. I mean, you've sat here and listened to their talk and talked about the future of psychiatry. How did that meld with what you're seeing? Obviously in a position where you're just talking to way more people than the average physician every day through social media and your email marketing and a book and everything.
Wow, I just have to say I'm so excited about the future of psychiatry. This is a dream come true for me, that every person who gets told that they have these quote-unquote symptoms or these diagnoses, that we can take that label away from them and we can give them back their health. And this is what functional medicine can do.
Absolutely. You want to add something to that, Michael?
Just a short plug. I'm starting a 6-week course for practitioners called the Autoimmune Mastery Program this Thursday. So if you'd like to join us, just go to autoimmunemasteryprogram.com.
All right, so a big round of applause for the panel. Thank you so much for being here. As I said earlier, we really want to get the Functional Forum meetups humming. There's so many meetups watching tonight. If you've been watching at a meetup, thank you. I know we've gone a little bit of time over. I can smell the paleo food coming from the kitchen below, so I know that it must be time to wrap up. The next date that we have is the Evolution of Cardiology. As I started, where I'm going to finish, is that we have in Dean Ornish's model a model where integrative cardiology is available on Medicare. And if you have a coronary condition, you can get that care. You can have 6 providers work on you and Medicare will pay for it. I think we've seen tonight that the future of psychiatry is very rosy. And thanks again to the whole team. And thanks very much for coming out and being here. This is the Functional Forum. Good night.